Hey guys, and welcome back to the channel. In today's video, I'm going to be talking about some symptoms that are associated when there is an imbalance in your glucose levels, okay? I think this is really important to know because it can make the difference of being diagnosed and knowing that you have type 2 diabetes and learning how to manage that diagnosis versus just not knowing and not knowing what's happening to your body and having these symptoms, all right? So first and foremost, glucose, also known as sugar, is essential for our body cells. Our body cells need glucose as a source of energy, okay? So that we can be able to perform, so that we can be able to do the things that we need to do throughout the day, having a source of energy. The issue is when there is too much glucose, this is what causes the health concerns. This is what can lead to type 2 diabetes. So knowing how to manage that and knowing how to have a safe balance in between your glucose levels is really, really important. So when your glucose levels are imbalanced, you can either have hyperglycemia or hypoglycemia. And so some symptoms that are associated with hypoglycemia, which is when your sugar level is low, some of these symptoms can include you may be feeling dizzy, you may be feeling sluggish, fatigued, you may be shaky, you may also be irritable. You can also be hungry when your sugar level is low. Hyperglycemia, some of the symptoms that can occur, you may be urinating more than usual. You may feel thirsty a lot, just drinking more than usual, hopefully drinking more water. And then the other symptom that can also occur is you have increased hunger with hyperglycemia. So I can't stress this enough. If you are experiencing any of these symptoms, it would be a good idea to go to your primary health provider and ask them to screen you for diabetes. Your primary provider can do a test called the hemoglobin A1C, and you would have some answers of how your blood sugar levels have been over the past 3 months. So really important to know. How can you prevent your blood sugars, your blood glucose levels from going through these spikes of high and low? How can you prevent that? I always say diabetes, having issues with glucose levels, these things are reversible with behavioral modification. So the first thing on the list would be, what are you consuming to nourish your body? What are the types of foods you're eating? And of course, the types of foods that are suggested should be whole foods. You should be consuming protein. You should be consuming vegetables. You should be avoiding a lot of processed foods. Instead of ordering out majority of your meals, you should be cooking your meals. This way you know what's in your food. You should definitely be reading your food labels so that you're cognizant of the ingredients in the food you're eating, okay? And you definitely want to make sure that you start some sort of physical activity. Keeping it very simple, if you have not exercised for a while, just start out with walking. Exercise is important because the muscles that you'll develop throughout exercising will use the excess glucose rather than the sugar just staying in your blood, which can lead to diabetes, insulin resistance, okay? So these are some of the tips to preventing your glucose levels from being in this chaotic sort of a frame where it's high and then it's low, and also preventing you from experiencing some of the symptoms that I mentioned before. So if you found this video to be helpful, I would like to know if you've ever experienced any of those symptoms, and most importantly, are you going to plan to, definitely get it checked out by your primary care provider, because ignorance is not bliss. Not knowing that you have diabetes does not mean that you do not have it. So definitely, guys, be proactive about it. Go get screened. If you know, it's better than not knowing. So I hope you found this video to be helpful, and I'm looking forward to touching base with you all again next time. Take care.